It's really, really wonderful to be with you all today. We're going to dive into this GI module, right? So the GI module is a wonderful place where we really focus on all the basics of functional medicine. And in this next lecture, we're going to talk about GI dysfunction and why we want to start with the gut, right? Like we always talk about, okay, let's start with the gut. In functional medicine, there's so much that we can do in terms of healing the digestive system that can have an influence over all of the body, right? So we're going to really focus on why do we say that? Why do we even say we've got to focus on the gut? How that influences both what's going on in the GI system, the local inflammation, and how that impacts the overall health of the body. And so this is a really great module for you to be starting with if you are starting, or ending with, or doing in the middle. It's really a wonderful way to put all of the information that you're learning within functional medicine and apply it to help your patients. So what we really want to focus on is how do we make this practical? What are some things that you can implement, day one to help your patients calm down the inflammation in their body, help their body get into better balance and heal? So with that, we're going to get started. And so we have no disclosures. Be open-minded, but not so open-minded your brains fall out. But this concept of health beginning in the gut is not just something that functional medicine talks about, right? We've been talking about this in medicine and in health for thousands of years. Here in 600 BCE, Samhita, who, these are some of the words that are the foundation for modern Ayurvedic medicine. And they said a person whose basic emotional and physical tendencies are in balance, whose digestive power is balanced, whose bodily tissues, elimination functions, and activities are in balance, and whose mind, senses, and soul are filled with vitality, that person is said to be healthy, right? So the digestive system is really critical to our overall health and well-being. Hippocrates, right? 2,500 years ago, focused on all diseases begins in the gut. So this isn't just something that, in functional medicine we say, oh, start with the gut. This is really rooted in medicine and health for years and years. The knowledge of anything, since all things have causes, is not acquired or complete unless it is known by causes. Therefore, in medicine, we ought to know the causes of sickness and health. And in functional medicine, we speak to this all the time. We're not just focusing on naming the disease, but asking that question, why? And it doesn't mean that we can always answer that question, why, but when we ask the question, why, we can start to go upstream and understand what may be out of balance in that person's body. So it's really important we ask that question and not just focus on the name of the disease and suppressing the symptoms, but asking that question, why, so we can move upstream and work to create better balance in that person's body and health. In naturopathic medicine, death begins in the colon, right? When in doubt, let's treat the gut. And then even more recently, right, Alessio Fasano has really highlighted the importance of the digestive system with all of his amazing research showing the connection between the digestive system and the overall health of the body. The possible causes of chronic inflammatory disease epidemics suggest a key pathologic role of gut permeability. And, we're going to talk this whole weekend, about what do we mean by gut permeability and what some people throw around the term leaky gut or increased intestinal permeability. What does that mean? We're going to really delve into that in further lectures this weekend. But really, he points to the fact that, when there is this imbalance in the gut permeability, that can trigger systemic inflammation. So studies have shown that the zonulin family, a group of protein modulating gut permeability, is implicated in a variety of chronic inflammatory diseases, including the autoimmune diseases, infective, metabolic, and tumoral diseases. So this is good to understand And it gives us a jumping off point, a place to say, okay, I need to work to get my patient's health into better balance. How do I help them lower inflammation in their body? How do I help their bodies start to heal? I'm going to start paying attention to the digestive system and the permeability in the gut, because those are things I can do to help my patients' symptoms improve and have their health improve. And what we're going to really talk about, a lot of times people think, oh, the GI module, we're going to be just focusing on people who are coming in with symptoms, GI symptoms, right? Bloating, diarrhea, constipation, heartburn, inflammatory bowel disease, bloody stools, right? Of course, we're going to focus on that. But we're also going to take this a much wider lens, because there's many times when somebody's coming in and they don't have any GI symptoms, but it's really critical that we focus on the digestive system, because as Dr. Fasano says here, that may be what's going on when this person is having this inflammatory disorder. So they have some autoimmune disease or some inflammatory process like eczema or acne or cancer, right? Or some metabolic imbalances. These are all situations where even if somebody's coming in without acute symptoms in the digestive system, you may be thinking about what's going on in the digestive system, what's going on in the gut. So we're going to talk about, why our objectives here, right? Why the assimilation node. So we'll bring up the matrix in a second, but the assimilation node on the matrix, how that affects all the other clinical imbalances in the body. And it's often central to personalizing your effective treatment plan when people come in with chronic disease. So not just when people come in with GI disorders, but when they come in with any chronic disease, there's many times you're going to be focusing on that assimilation node. We're going to talk today, this lecture further on this weekend, about how barrier integrity, digestion, absorption, the gut microbiota, and nutritional insufficiencies are important in the diagnosis and management of patients with both digestive dysfunction as well as all chronic disease, or many chronic diseases. So IFM has really put together a few really important frameworks for you, and we are going to come back to this again and again throughout this whole weekend, right? So these are important frameworks that if you haven't heard of before, you are going to hear about many, many times throughout this weekend. The first is the dig-in framework. So it's digestion, absorption, intestinal permeability, gut microbiota dysbiosis, inflammation and immune dysfunction, and nervous system imbalances. And that framework is going to help us determine and organize all of our information when we're trying to figure out what's going on with our patient. The other framework that you're going to hear about so many times this weekend is the 5R framework, the 5R model, right? And that's something that you're going to be doing on day one if you haven't already started to implement with your patients. So the 5R program is a way that you can help the body heal. It's a way that you can help the body's digestive system heal. It's a way that you can help improve that intestinal permeability so we can lower inflammation in the body, right? So we can help with taking away some of that systemic inflammation that may be coming from the gut. And so often at the beginning when you're doing functional medicine, or actually even at this point, after I've been doing functional medicine for years and years, you get these complex patients and you sometimes wonder, where am I going to start? Where am I going to start? And the 5R program is such a great starting point for so many of our patients. And so if you get a complex patient and you're lost, this is a great thing to pull out and say, okay, I'm going to do the 5R program with this person. And don't worry, this whole weekend, we're going to be doing it with you many, many times, giving you examples of how we do that 5R program. So we'll go through it again and again with different scenarios, explain how it's done, so you don't have to think you've got to figure it out right now, and then how you can practically implement it into your protocol with your patients so that they can heal and get better. So again, you've got that patient coming in and they've got some systemic inflammation and you think maybe it's coming from the digestive system. Then you say, okay, I'm going to do this 5R program to see if I can start to cool down that systemic inflammation. So we'll go through that this morning as well as throughout this weekend. The remove, replace, reinoculate, repair, and rebalance. And that's really can be a great starting point for so many patients. So I'm going to integrate a patient throughout this lecture this morning. So we just bring it a little bit more practical. And the first person I'm going to talk about is Trina. And Trina came to see me. And the reason I chose her, actually, because she didn't really come in with a lot of GI issues. She came to see me with her vitiligo and her joint pain. And I wanted to sort of give you an example of a situation where somebody's coming in for other issues and you start to say, okay, I've got to think about what I learned in that GI module and incorporate it with this patient, right? So that's what I wanted to think about. So Trina, 44-year-old woman who came in, she wanted to optimize her health and be well, but also focus on the fact that she's got some joint pain going on and she's got this vitiligo and she doesn't want them to get worse. And so she wanted to know, what can I do to prevent them from getting worse? She also struggled some with anxiety and some sleep issues. Many things started when she started her business in 2016. There was a lot of stress around that time, and many of her symptoms flared at that time. She has 2 daughters, ages 12 and 14. And so, we remember the functional medicine matrix, right? So here's the functional medicine matrix where when you start to take all that information that you're gathering from your patient, right, you start to organize it around the matrix. And this reminds us of things that we want to focus on, right? And I always, when I take the information that's been gathered on our patients, I always sort of start to fill out a matrix. Because it helps me focus and figure out where I want to focus with my patients, right? So I want to think about what are their antecedents, triggers, and mediators. And for those of you who aren't as familiar with functional medicine, we'll be describing what those are again in a minute or two. I want to think about what's going on within their personalized lifestyle factors. Where can I have some traction? Where can I cause some improvements in their overall health by making some changes or working with them to make changes? What's going on in their mental, emotional, spiritual well-being? And then all of those systems that are surrounding that, the assimilation, defense and repair, energy, biotransformation, transport, communication, and structural integrity. So I'm thinking, as we're gathering that information on our patients, where does it go on their matrix? And where do we need to focus? And as I said, sometimes it's going to be a lot of area in the assimilation node, but all of these other nodes on the matrix are interrelated and influencing each other. So just to remember some of the key concepts of functional medicine, right? What is functional medicine? Functional medicine is good medicine, right? We are focusing on the continuum of health and wellness, balance in the body, biochemical individuality, and patient-centered treatment, right? And asking that question, why? So let's take each of those key components one by one. The continuum of health and wellness. This, I really love this concept of the continuum because I think it speaks so much to what we're really focusing on in functional medicine. We're not just focusing on, okay, does somebody have a disease and what kind of things do we need to do to suppress those symptoms? But really, what can we do with each of our patients? How can we design an individualized treatment plan to help that patient move along their continuum toward their optimal health? I think that's really important, right? That we sometimes, we get so focused on the name of the disease, we get lost in what's really going on with that patient, right? And where are they in that continuum? And how can we help them move along that continuum toward their optimal health and well-being? There are times where we're able to remove a disease, right? We've got somebody with type 2 diabetes and we help them make changes in their lifestyle and they can reverse it. And we can actually take that ICD-10 code off their chart. But there are other times where we don't always remove that ICD-10 code, right? They still might have Crohn's disease, but we can help them move along their continuum of health and be their most optimal health and at their most optimal well-being, right? So that's, I think, really important. And we also know on the other end, we're not just sick, healthy one day and sick the next, right? There is this continuum of health. And I think what's great about functional medicine is we speak to that, appreciate that, and then help each patient create their individualized treatment plan so they can move toward their optimal health and well-being. Balance. Balance is so important, right? It's probably the most important. When you end up speaking with your patients, you realize that we just live in such a way of imbalance too often. And balance is important for each individualized patient. It's important for nature and the world. And, how do we help our patient create balance? You'll notice, or you've noticed this already, you've got that patient who comes in who is not really paying attention to anything they're eating whatever they want, and are not well because of that, right? Because they're choosing whatever, they're picking up fast food or that standard American diet or a real processed food diet. And as a result, they are out of balance and in illness, right? But on the other hand, we get a lot of patients who are so focused on every single thing they're putting in their body, right? They're overly focused and overly restrictive. And we see a lot of imbalance with that as well. So it's important that we're paying attention to that. Same thing with exercise, right? So often we see people who aren't doing any exercise. And then on the other hand, we're seeing patients who are exercising way too many hours a day, and they're depleting their body and they're depleting their energy and even making it so their gut can't heal, right? So balance is critical. And when we talk about balance, it's important that we bring up the mental, emotional, and spiritual well-being, that center of the matrix, which is important for us to get a sense of when we're gathering that information on our patients, because so often there may be imbalances here in the mental, emotional, spiritual area that is what is kicking our patient out of balance, right? So what are their perceptual patterns? How do they handle sadness and grief? What is their spiritual meaning and purpose? And that's really, can help our patients when we're focusing on that, help them get into better balance. Biochemical individuality. Biochemical individuality, that is the next key component in functional medicine that it's important for us to remind ourselves about and highlight in this introductory lecture, right? We are all individuals. We know that, but it's important in medicine that we focus on that when we're working with our patients. And, so often, we are talking about, okay, the most recent research article and all of that. And it's important that in research, we bring into account all of our biochemical individualities. And so as we're learning more about the genetic environmental interplay, I think it's really critical, and it will be really critical, that is brought into all of the research that is done, so we can determine the most likely reasons that people may be getting sick or ill, or their body may be getting out of balance. So really important to recognize the connection between each individual and how they respond to their environment, and how that's important when we're doing research. And when we take into account genetics and genetic variations, that's going to really influence the research, the epidemiological research and research in general that we're getting. And so often, for many reasons, that's not taken into account, sometimes because we don't even have the information yet to understand. In addition, we've got trillions of microbes that are covering our digestive system and our skin, and that's really influencing who we are as individuals as well. And so, that's going to influence the research in terms of what we find how somebody responds to an infection or to a food or to their environment. And so as we learn more and more in this area, I think we're going to appreciate more and more how our microbes are influencing our overall health and how that has an impact on who we are as an individual and our biochemical individuality. And then finally, but maybe not so finally, this, functional medicine is really patient-centered treatment. We are not just focused on naming the disease and then finding the medication that's going to suppress those symptoms, or we're also focused on, okay, that individual patient and what is going on and what may be out of balance for them, right? We're taking into account their genetics, their environment, how that comes together and creates that phenotype who is me, right? Or you, or who is us, right? How we are all individuals. And that really is important when we're creating our treatment plans. This is an article, and I'm going to speak to this more tomorrow and in another lecture coming up, but it just speaks to the fact that we are all individuals, and we're learning more about this gene, the NOD2 gene, which is a gene that impacts somebody's risk for getting Crohn's disease. And when people have a homozygous variant in this gene, their risk of getting Crohn's can go up by a factor of 20 to 40, because this NOD2 is something that's involved in impacting the gut immune system. So this NOD2 impacts how the body responds when a bacteria, an abnormal bacteria, they're exposed to in the gut. So when the gut is exposed to this abnormal bacteria, people who have a variation in this gene, they don't always fight off that bacteria as well as somebody who doesn't have that variation. And they may have an overabundance of an inflammatory response. And when those things come together, that can create Crohn's disease, right, or a disease. So it's important for us to recognize that our genes that impact our immune response, that impact our cytokine response, are interfacing with the environment that we're exposed to. So not everybody who has exposure to this abnormal bacteria will go on to create an inflammatory bowel disease, but some people will because of their genetic makeup. And that's important to recognize. And what we're learning is more and more we are influenced by the imbalances in our gut, and people are influenced differently. So certain bacteria for one person may be more of a concern than for somebody else. And probiotics, certain good bacteria for some people might work better or help lower inflammation more than they will for somebody else. And the same thing with food sensitivities or food reactions. We are all individuals, and that is important to take into account when we're developing somebody's treatment plan. So fundamental approach in functional medicine is to focus on these antecedents, triggers, and mediators. And this really gives us a lot of information about where you're going to go with your patients. These antecedents, triggers, and mediators really help you understand where you're focused on your treatment plan. So, your antecedents, your genetic predispositions, or early environmental exposures are influenced by different triggers. We'll go through some of those in a second. And then the mediators can influence whether that will continue to create disease or not. And some of those mediators may be your genetic predisposition, like we were just talking about with that NOD2 gene, and how that creates a more of a feed-forward inflammatory response for some people and not others, right? So antecedents are things like your genetic predisposition. How were you born? What was your birth history? We ask every patient their birth history because we know it's so important how you get inoculated if you're getting by bacteria, if you're getting born vaginally versus C-section. So that's important. Were you breastfed or not? Did you have antibiotics during labor? Did your mother have antibiotics during labor? I meant to say, did you have a lot of antibiotics in early childhood? How were you fed as an infant, right? Were there any adverse childhood experiences, right? How all of that impacts your overall health and well-being. Of course, your genetics, genetic variations, that as well, your early lifestyle exposures to things, your nutrition at an early age. All of these things can fall into that category of antecedents. Triggers, I find triggers to be a really helpful thing to be paying attention to with my patient. You want to ask that question to your patient. Well, sometimes we ask all the time, what do you think was the trigger for this illness or this imbalance for you? What do you think what was happening right before you got sick, or for the 6 months before you got sick? Was it, an infection? Was it a gut infection, which so often with, even, celiac disease getting started, or an inflammatory bowel disease or an autoimmune disease. Sometimes it's an infection that can be that trigger. So you want to try to figure that out if you can. I had a patient the other day, and I was explaining to the patient's mother, because he had, all of a sudden at 15 developed celiac disease, and she's like, well, was he born with this? Or, but it was, he was hiking in the woods. He got a gut infection, and then the gut infection just never went away. And then when they did more testing, he was found to have celiac disease. And she was questioning, well, how long has he had this? And it's many times where there's you have a genetic predisposition, right, that antecedent, and then there's a trigger, like an infection, and that creates an inflammatory response that then can turn into something like celiac disease or another autoimmune disease, for example. So thinking about the trigger with our patients is really important, because it helps us when we can figure out, and we can't always figure out the trigger, but when we can think about what those triggers may be, it helps us try to remove what some of those triggers may be and create a better balance. Or maybe the trigger was antibiotics. So often that can be a trigger for a change in the digestive system. And so, we think about that. Could it have been an antibiotic exposure, or a trauma, or a change in hormones, or a toxin exposure? And then mediators, there's many different mediators out here. Here are some biological mediators. The certain people will have a more pro-inflammatory response, whether that's because of their genetics or whether because of their lifestyle, for example. And that can create this feed-forward cycle. So again, antecedents, that's your congenital, right? Genetic, demographic, dietary, some certain habits you were born with. How did you learn how to respond to stress when you were a child? What kind of patterns did you learn? What were environmental exposures, occupational exposures? Were there early traumas? Triggers, as I said, I think we've kind of gone through this a lot, but I think it's important to really focus on, was it a trauma? Was it an infection? Was it antibiotics? Was it a stress? What could be that trigger for that patient? And mediators, can be, hormones, or shifts in hormones, or your lifestyle, or your beliefs in a situation, or how you were conditioned to respond. All of these things are important to determine where you're going to work with your patient so that they can get their health into better balance. What do you need to remove? What do you need to pull away? What do you need to help them change so that their health can get into better balance? And don't get so worried about, okay, is this a trigger, or is this a mediator, an antecedent? Sometimes things fall in all three categories, and that's okay. That's okay. Okay, despite significant advances in biology over the past 2 decades, much of this knowledge has yet to be translated into medical practice. Yeah, that's true. There is an evidence practice gap, and the concept of evidence-based medicine sounds just so straightforward. Like, okay, that we just got the evidence and we should just translate that into medical practice. But it's sometimes so much more complex. Studies here have shown that there's a low rate of compliance for evidence-based treatment guidelines. Also, we recognize that some of these treatment guidelines are so influenced by pharmaceutical or insurance companies, and sometimes the research is coming from those areas as well. So though it sounds simple, it is sometimes complex, and there can be this evidence practice gap. And as Dan showed you earlier, this is really important, this diagram, when we're talking about evidence-based medicine. So often we think, oh, evidence-based medicine is just that double-blind, placebo-controlled, one disease, one treatment research study. And that's important to put into this category of evidence-based medicine. But evidence-based medicine is so much more. It agrees and is been put together to focus on, okay, the best research, including that double-blind placebo-controlled trial, but all research that takes into account our genetic variations, as we were talking about, but also our patients' preferences and our clinical expertise. And we bring all of that together to create the best medicine for our patients. And that's truly what we are focused on in functional medicine. Okay. So I promised we were going to be going through some of these different frameworks. And this is the first one that, we're going to come back to again and again this whole weekend, is this dig-in model. And I find the dig-in model a really helpful way for me to understand the importance of focusing on the gut, like we started talking about, right? Why do we want to focus on the gut? And how the gut influences our overall health and well-being. So digestion and absorption, as a nutritionist in background, I'm a physician now, but my background's all nutrition, and I believe in nutrition and the power of food. We recognize how important optimal digestion and absorption is for overall health and well-being. If we can't digest and absorb our foods and pull all those critical vitamins and minerals and nutrients and phytonutrients from our food and protein from our food, how do we heal? So digestion and absorption is really important, of course, and it has a widespread influence on the health of the body. Intestinal permeability, we talked about this earlier today, and we are going to talk about it again and again and again. It is the first I in the dig-in model, but that first I does influence, the second I, which is immune and inflammation. And the first I really influences, systemic inflammation in the body. The G is for the gut microbiota, or is there dysbiosis? What's the balance of the microbes in the gut? Are they out of balance? What do we need to do to put them into better balance? How is the gut microbiota influencing the overall health in the body? And then inflammation and immune. So that's both focusing on the local inflammation and the immune system, the local gut immune system and inflammation, as well as how that's influencing systemic inflammation and the immune system. And the N is just for the importance of the nervous system, both the central nervous system as well as the enteric nervous system, and how that influences our digestion, for example. So when our sympathetic nervous system is upregulated, that's going to influence how well we pull our nutrients from our food and how the process of digestion occurs. So this dig-in framework, I think, can be really critical for organizing your thoughts on a patient. And we're going to be delving into each of these components this whole weekend and helping you learn more about what you're thinking about within each of these areas, and how, if you feel like that's the area you need to focus on, how you can help your patient heal. Okay, and then the 5R approach, the 5R program, as I mentioned earlier, we're going to go through this many, many times this weekend. Remove, replace, reinoculate, repair, rebalance. So let's delve into that for a second. What do we mean by these 5 Rs? So the first is remove. And remove is really removing any dysbiosis or pathogens, as well as removing any food source that may be causing allergy, inflammation, so any food sensitivities, allergic foods, any food intolerances. This first step in the 5R program is remove. And, remove was placed first because it's often the thing you do first with your patient. So, but it doesn't mean that has to be what you do. And what we'll come back to a lot of times this weekend is how important how important it is for you to customize your 5R program, right? So you want to have a really, you don't want to do everything for every patient. You want to figure out for that patient what is the most important area for you to focus on for them, or maybe there's a couple areas. You don't want to throw the kitchen sink. Not everybody needs to remove a pathogen. They might just need to do a comprehensive elimination diet, right? And the idea of remove is that we're going to work to remove inflammation for that patient. Replace is what do you need to add in to help that person digest their food better? So again, not everybody needs support in this area of replace, but if they do, what are you going to replace them with? And we're going to talk about that later this morning, right? Well, it may not be morning for you, but later on today. So replace, that may include hydrochloric acid, right? Betaine HCl to increase stomach acid to digest better. It may include bitters and herbal formula to help increase the amount of digestive enzymes and acid in the stomach. It may be adding in or replacing a digestive enzyme or something that helps breaking down fats or that's lipotrophic, like bile salts. All of these fall into the replace category. Reinoculate. So this includes probiotics, right? So lactobacillus, bifidobacter, spore-based probiotics, Saccharomyces boulardii. But also in the reinoculate area, we need to focus on what are we feeding those probiotics, because that's really critical. And what we're learning more and more about is that may even be more critical, probably is. What are we feeding those good bacteria with? What prebiotics are we using? How are we changing that patient's diet so it shifts their microbes? And all of that falls into the category of reinoculate. And then repair. I think this is such an important area, because repair, you need to have adequate nutrition. You need to have adequate nutrition for the gut to heal. So if your patient has done like a comprehensive elimination diet, but they're not getting better, you've got to think about, well, have they removed too much? Are they not getting adequate nutrition? Are they getting adequate protein, vitamin A, zinc, all of these things for healing the gut? Other things we use to repair include glutamine, butyrate, fiber, omega-3 fats. Even fasting can fall into that category, because we know that a lot of repair occurs in the time we're not eating. So that's why that's on the list too. And then, of course, rebalance. This is the 5th R, which is really important, of course, for the gut to heal. The importance of focusing on self-care, adding in relaxation exercises with your patients, helping them change their connection regarding their lifestyle and their attitudes and their diet, and really having them add in some ways of giving their body time to rest and heal. Because the body has this tremendous ability to rest and heal. We just have to put it in the right place so that can occur. So if you suspect increased intestinal permeability with your patients, this 5R program is a great place to start. And also just a great place to start, as I said, if you've got a complex patient and you're not even sure where to go, this is a really good basic foundational framework for you to really focus on. And many times in my chart, I will write down with my patient the plan, right? Okay, we're going to do the 5R program. And then I might write down all the 5Rs and say, okay, we're going to focus on remove and repair. You're doing pretty well in replace and the other Rs, but those we're going to focus on. And I'll even write it down for them. And that can be really helpful. Okay, so we talked about this functional medicine matrix, and as we gather our information for our patients, we are filling it into the matrix so we can determine for them where they need to focus. And what we did for you is we put together these clinical decision trees. And so there's a few that you're going to see. And the idea of these decision trees were to help you take all of this information we're giving you and create a way to help you individualize your treatment plans with your patients. So a way to bring all of this information together and have a decision tree to help you guide you along the way. So the first one we're going to introduce is the GI decision tree, right? So this is your basic decision tree for this weekend. And you know what you have this as a laminated sheet, and so you can pull it out now if you'd like to, if that's at all helpful for you. And it's a way to help guide you through the go-to-it model when you're doing functional medicine with your patients. And we're going to do that today. We're going to take you through all of these different steps and show you what we put together line by line on this decision tree for you. Okay, so gather is the first area up at the top, and that is when you're gathering, you're getting your medical history, their timeline, which is so important. You're getting the ABCDs of nutrition assessment, where your A is your anthropometrics, your B is your biomarkers, your C is your clinical indicators. What do you find on physical exam that may indicate things may be out of balance? And your D, your diet and lifestyle form that they filled out. And when you look at it, what are you gathering about what that patient is doing or not doing, right? So your questionnaires, your MSQ, you're gathering all this information and then organizing it around the matrix. So let's go back to my patient. She was that 44-year-old woman with the vitiligo and joint pain. Here's a little bit of her history. She was born 3 months premature, so we're gathering all this information now, right? She's born 3 months premature by C-section, and she was bottle fed. She had a lot of food allergies and was low in energy in her childhood. She had a sister with vitiligo and a mom with rheumatoid arthritis and osteoporosis. She was on a lot of antibiotics for 4 years in her 20s for her skin. She had always had some exercise-induced asthma, but when she had some exposure to some laundry detergent that was further recalled, she had this real exacerbation of her asthma. And as a result, she had to change. She couldn't run as much, and she was using her inhaler so much more. She realized when she stopped the laundry detergent that things calmed down in her lungs, but she was prone to asthma and reactivity. In pregnancy, she started to have some vitiligo. Her hands were achy and she had some swollen knuckles at times. She had eczema, as I said, vitiligo, and she used Retin A for her acne. And her periods were regular. She struggled with some constipation and bloating. She did have some sensitivity to oats and milk, but she wasn't really following a strict elimination diet now. One of the reasons, and she mentions this a few times, is she has young teenage daughters, and she didn't want to be too restrictive in her eating because she wanted to show a very balanced eating approach, and that was really important for her. She had some insomnia, but she had a pretty good sleep hygiene, but still had some trouble falling asleep. And sometimes she would use like Benasom or Unisom. She didn't have a regular meditation or relaxation practice. And she had some anxiety at the present time. She was on Lexapro. Okay, so what are her ABCDs of nutrition assessment? Her anthropometrics were all really good, so I didn't bother to list them here. She didn't come in with any recent biomarkers or labs, so I will go and do some, and I'll show you that in a second, but she didn't come in with any. On physical exam, her tongue had some like whitish coat, no silver fillings. She had multiple areas of vitiligo on her ankles, backs, and hands. On her nails, we saw some vertical ridges. And for those of you who did AFMCP, you're thinking about, what are you thinking about? You're thinking about protein, you're thinking about iron with the vertical ridges, you're thinking about digestion and absorption. She had a bunch of knuckles that had this red thickened skin in the PIP area joints, but there was no active swelling at this time, just some red thickened skin. And as I mentioned, she wanted to have a healthy, balanced food plan. So in this decision tree you see here, right, we take all of that information that we gathered, and then we're going to organize it along the matrix, right? And this is really, that matrix is that thinking pad. It is something you can show to your patients. It's something you can write on and circle and show the connections. I love to do that. We put together, and this is going to be on the other side of your that laminated sheet. On the flip side, you're going to see the usual suspects. And, you know, this is, these are just some things you might see when you're gathering that information that may make you think about, this is a GI issue, or I want to think about the gut and what's going on in the gut, right? So, of course, in antecedents, if they have a family history of GI disorders, if they were born by C-section like this woman was, if they had antibiotics around labor, triggers, we talked a lot about this, diet, antibiotics, toxins, did they have their gallbladder removed? Mediators could be some continued dysbiosis or inflammatory response, or are they continuing to take a PPI? And we're blocking stomach acid, and how is that creating a feed-forward situation for this patient? Under lifestyle factors, of course, sleep is really critical for healing in the body, and so if somebody's not sleeping well, what do we need to do and focus on? Are they overtraining? Are they over-exercising? Or are they not doing any? Under nutrition, you know, are they overly restrictive? Are they not eating enough food for their gut to heal or for their body to heal? Do they have a history of restriction? This is good information to gather that gives you information about what might be going on with this patient's health, their GI system, their nutritional system, their body's ability to heal. Are they drinking too much caffeine, right? What's going on under stress? Do they have any coping skills? Are they overworked? Do they have good support? Then you go up into the center of the matrix. What's their mental, emotional, spiritual well-being? Do they have purpose? What's their body image like? Are they dealing with grief or anxiety? And then what are some things you may put in all of the different nodes? So under assimilation, if somebody's on an acid blocker, or you think they may have low stomach acid, and don't worry, this weekend we're going to talk about what may be causing low stomach acid, right? And how do you know? How do you even know? But you might write that in here. Do they have signs of low digestive enzymes or pancreatic insufficiency? Do they have signs of under defense and repair, reacting to everything? They have lots of food sensitivities or allergies or asthma or eczema or inflammatory bowel disease or autoimmune disease. Under energy, are they constipated? Are they getting headaches? Some signs of histamine intolerance. Biotransformation, also thinking about constipation because you need to get rid of your toxins. And what's their transport like? Under communication, is there imbalances in their hormones, their neurotransmitters, thyroid dysfunction? These are things you might be putting on a matrix if this person has digestive issues. And under structural integrity, you see increased intestinal permeability. So again, you can put that here. You may also choose to put increased intestinal permeability under defense and repair because, of course, that can create inflammation in the body, or you may put it under assimilation. So just so you know, things can go in many different areas, and we don't want to get too hung up on that. So going back to my patient, here's her timeline. And I put under antecedent, she was born 3 months early. She was bottle fed. Her mom and sister had autoimmune disease, a definite antecedent, right? Because when you have a family history of autoimmune disease, of course that increases your risk. And then under her timeline, I put down here she had low energy most of her childhood. She had a lot of food sensitivities and allergies and migraines. She did have some exercise-induced asthma. She was on antibiotics for 4 years for her acne. And how did that shift her microbiome? She got pregnant and then started to have some vitiligo. And she started to have these achy hands and swollen knuckles. Her asthma worsened with that laundry detergent exposure. And she also has some anxiety. So I hear under current concerns, I write down, she's a 44-year-old with vitiligo and joint pain, but this is her timeline. And some mediators, the constipation and bloating is a continued mediator. She's sensitive to some foods, but she's not avoiding them because she wants to be more balanced. She's got this anxiety. She has insomnia, even with some good sleep hygiene, but no stress reduction practice. So this is how I filled out her matrix. Her timeline. Okay, so you take all that information from the timeline, from the matrix, and then you want to determine for her what are you want to organize it all for her. And so actually now I need your help here. I want you to think about what are some of the antecedents for Trina, right? So when you're putting together her matrix, what would you put as antecedents? Okay, and then Dan showed you where to put those in. If it's more than one word, definitely put the hyphen in, hyphenate it. So it doesn't come up as I don't want to give you one away, but C section. Okay, I gave you one. It doesn't come up as C and then section. Definitely put a hyphen in there. And so, so let's practice with this word cloud. Yeah, what do you think are some of her antecedents? Great, yeah, C-section. And then you can see here with the hyphen there. So when more and more people put that in, that area is going to get bigger and bigger. We're going to see more people agreeing with that antecedent. So you are filling out her matrix, and you are figuring out what the antecedents may be. Lots of people put in those antibiotics, right? She was born by C-section, her birth history. So she was born 3 months early. She was 3 months early. That's a definite antecedent. She has a family history of autoimmune disease. You guys are so good. There's so much popping up now. A family history of autoimmunity. She was premature, bottle fed, born by C-section, allergies and sensitivities. Let's see if there's a family history of autoimmune disease. I think you guys got it all. Okay, so here's her matrix. And I did just what you said. I put under antecedents, mom with autoimmune disease, sister with autoimmune disease, born 3 months early, and antibiotics. Now you guys got it all. Okay. And then triggering events may be the pregnancy is often a trigger for autoimmunity, stress with her business, and the exposure to the laundry detergent definitely had an impact on her ability to run and how that helped with her stress management. I put under sleep and repair. This is how I'm filling it out for her when she came in to see me. She's got this insomnia. She at this point, she was back to running, so that was great. And she was doing strength training. Under nutrition, I put her nail ridges because I was thinking about, okay, does that mean she's low in iron or protein? It made me think about what's going on in her digestion and absorption. She didn't want to be overly restrictive, but should she be more restrictive is what I was wondering. For her, she was not doing any stress management practices at the time, so I made note of that. She had good relationships and networks. Under biotransformation, I put the asthma worsening with the laundry detergent. I put under communication her regular periods, but also the Lexapro for anxiety. I put under structural integrity, the joint pain that she came in with. Under assimilation, that she was constipated and had these nail ridges. And under energy, fatigue, and migraines. And under defense and repair, there's a lot there, as you can see, right? She's got acne, she was on Retin-A, she's got eczema, vitiligo, joint pain, exercise-induced asthma. And so as I said at the beginning of this lecture, I knew we needed to focus on defense and repair, but I also knew that there was connection with her digestive system. And that's why I wanted to bring her up in this lecture today. Okay, so now is the really important time where you retell the patient's story, because that's really critical for developing that therapeutic partnership and letting your patient know that you heard them. So I would say to Trina, with your family history of autoimmune disease, redness in your knuckles and joint pain, I know you want to take control of your health and decrease your risk of autoimmunity. And we know there's this connection between your gut health and the overall health in your body and autoimmunity. So we're going to start with focusing on your digestive health and lowering intestinal permeability, so we can really lower the autoimmunity in your body and prevent this from getting worse and maybe even reversing it. And then I really wanted to acknowledge the fact that so I would say, I know you want to be on a real balanced eating program so you can show and model balanced eating for your daughters and not extreme or imbalanced eating. But we're going to really test to see if there's any food that we should be pulling away more. So, and I think that helped her feel heard and understood, retelling the story. And then order comes next. And remember, when you're ordering with your patient, you're thinking about what are your patient's priorities and what patterns do you see and where do you need to focus? So in the dig in model, this goes here on your decision tree, digestion and absorption, right? And they're giving you some ideas of why you might think about digestion and absorption. Is there abdominal pain after eating? Is there reflux or belching or constipation or nausea? Why you might think about increased intestinal permeability? Does somebody reacting to all the foods that they're eating or so many foods? Because then you just want to work on healing that so they're not so reactive to healthy foods. Do they have this diffuse inflammatory response? Are they having a high MSQ score or autoimmunity in the body? You may be thinking about the gut microbiota if they've got a history of ulcers or loose stools or irritable bowel or gas. And maybe you're thinking about immune and inflammation, and this is an area to focus on in the dig-in model. If they've got a lot of systemic aches and pains, frequent infections, high CRP or SED rate, high adiposity, because that creates inflammation. And then, of course, in the nervous system, what's their level of depression, anxiety, history of traumatic brain injury, or decreased motility. And we'll talk a lot about motility this weekend, so don't worry. But for Trina, right, what did I focus on? So her digestion and absorption made me wonder about, okay, she's got this constipation and nail ridges. I'm wondering, how is her digestion and absorption? Do we need to do anything here? For intestinal permeability, I was concerned about that with her food reactions and this inflammation that she had in her body. For her gut microbiota, we do know there's a connection between dysbiosis in the gut and autoimmunity. So I was thinking about what's going on in her gut microbiota. And I was thinking about inflammation and the immune system because of this systemic autoimmunity and the joint pain. And her anxiety. So what do we need to do about her nervous system? I was thinking about all of those in her dig-in model. That helps me then determine, what do I do? What do I need to initiate? Where do I need to initiate and focus? So the goal of initiation, right, the first thing we want to focus on is what can we shift in the modifiable lifestyle factors and the mental, emotional, and spiritual well-being, right? What can we shift there to help our patients heal? And then the other things you may initiate is different testing, supplements, medications, but focus first about what can we shift in terms of the modifiable lifestyle factors and the mental, emotional, and spiritual well-being. And here, this is highlighting the fact that we start with the personalized lifestyle factors and mental, emotional, and spiritual well-being, and where does this patient need to start? And, it may be something from focusing on sleep or an elimination diet or a stress management program. And, Dr. Liz Lipsky is going to really focus on all the different dietary interventions that you can do in terms of gut health. And she'll really get into that a lot this weekend. But so I need your help again. Okay, I need your help again. And I want you to think about what do you think you should focus on with Trina? What modifiable lifestyle factor do you want to do? What modifiable lifestyle factor do you want to add in or help her work on to, where should we start? Where should we start? And again, if it's more than one word, hyphenate, because that'll help. But, is there something in her mental, emotional, spiritual well-being that you want to investigate more? Or where do you think she needs to change her her lifestyle factors to help with healing? Yeah, so you're wondering about, should we be doing any dietary restriction? Should we be doing any elimination? And we just want to think about how we have that conversation with her. Once we make sure she doesn't have celiac disease, how do we have that conversation so it can be in a more balanced way for her? Because that's very important for her. And sleep, definitely an area we need to focus on for her. Stress management, you guys are good. 6,000 steps, better breathing. You guys got this. So this is what I did with her. She did have some good sleep hygiene, but she wasn't doing a relaxation program yet. So, or she wasn't doing it recently. So we added in, she liked the Calm app. And so that's what we used 10 minutes in the evening. I also gave her some magnesium glycinate and phosphatidylserine. And cognitive behavioral therapy, I recommended if these things weren't helpful enough, because that can be really, really helpful for some people who get into a really unhealthy sleep pattern. She had good movement. And, with nutrition, we started with focusing on making sure she was getting adequate protein and adequate calories for healing. And then in terms of food restriction, because of how she came in, somebody else, you might put them right on an elimination diet. But because of how she came in, I wanted to do some testing first. And we've really focused on breath work with her as well. So then the next step in initiation is when you decide what labs you may want to order. And that's really after you have tried some of the changes in modifiable lifestyle factors and focusing on mental, emotional, spiritual well-being. What testing may you want to do? And, these are some examples of what might be appropriate on that first visit, right? So the PFC MVP, remember, that's the way that we organize our nutrition assessment with protein, fats, carbohydrates, minerals and vitamins and phytonutrients, any microbial analysis. Is there excessive C-reactive protein or calprotectin? How are they digesting? What's their level of pancreatic elastase? We're going to delve into this all this weekend. This is just to organize it for you. Is she having any adverse food sensitivities or reactions or allergies? Does she have celiac disease? So this is what I found for her. She had a ferritin of 11, so we see that's low, and that may be really contributing to these nail ridges. We see here her omega-3 level is low. We did an omega-3 index. So we definitely want to focus on bringing that up for lowering inflammation in her body and for healing the gut. We did some genetic SNPs, and we did find out that she had a variation in the COMT. She was a MET homozygous variant, which does increase her risk of anxiety. So it's important to let her know that and explain that to her, and just important for her to know that, okay, that this is why it's so important for you to focus on those regular daily stress reduction techniques. We do see she has a positive ANA, but I was really reassured by the fact that her rheumatoid factor, her CCP, and her CRP and SED rate were all in the normal range. It makes me feel more comfortable that we can really focus on this functional medicine approach, and that she doesn't need any medication necessarily right now to reverse any symptoms. We did a celiac panel on her, and it was good. She had a normal total IgA, tissue transglutamase IgA was normal, DMA to gliadin was all in the normal range. But we did do some food sensitivities on her. And, this is what we found on her. This is a company that does both IgG and IgE, food allergies and sensitivities. And so what you can see here is she didn't have celiac, as I showed you earlier, but she does have some elevated IgG and IgE to gluten and wheat and some other foods on here as well. And, her focus was, how can I lower autoimmune disease, decrease vitiligo, and prevent any further problems with my joints? So I also wanted to do some checks to see if there was any dysbiosis or imbalances in her gut microbiota. And we can see here that she did have some potential dysbiosis. We see on stool testing, her commensal abundance was high, and We see that there is some imbalances in the urine, the dysbiosis markers. These here on the right-hand side are coming from a urine organic acid panel. Sometimes food can impact these results, but we do see here that diarabinitol is high, and that can indicate that she's got some yeast overgrowth. And we also see here that she's got some overgrowth of blastocystis. And not that we have to treat everybody with blastocystis, but that can be a sign that there may be some dysbiosis or some imbalance in the gut microbiota. Her pancreatic enzyme level was normal. Okay, so next is our treatment, right? What do we want to do? And the first thing, as we talked about earlier, is that 5R program. And so I want you guys to help me out here again. And I gave you some of her information. You're going to do the 5R program with her. Which of the 5Rs do you want to start with for Trina? Which one do you want to start with? And you know what? I want to just start with the fact that there's no right answer here. So don't be afraid to answer this question, because there really isn't a right answer. There's so many different ways you can go. And so, you know, I don't want anybody to feel like, okay, there's just one right answer here. I just want to see where you guys might go. So we've got a lot for remove. Absolutely. Remove is often the place we start, right? We're removing inflammatory foods. We're removing dysbiosis. But we may want to do some replacement. You know, sometimes we'll do replace because that using some things to help digest food, because then you're less reactive to foods, and that can be helpful. And repair, you know, I think I might agree with you guys. I really focused on remove and repair as well for her. And so here's her personalized, her 5R program that was personalized for her. So I used an herbal antibacterial agent. So I used a combination of herbs that help with getting rid of the dysbiosis. I did that for 6 weeks. And I had her cut way back on gluten, eggs, and almonds and soy, because that was what she reacted to on that food panel. We'll work to reintroduce those and see if they're necessary to remove long-term. I didn't add anything for replace for her right now, though you could. Sometimes people do, and sometimes I do when people are reacting to a lot of foods. For reinoculate, I focused on a high fiber, high phytonutrient food plan, I gave her some probiotics, acacia fiber, and some spore-based probiotics as well to reinoculate. I focused on making sure she was getting adequate protein and nutrition and omega-3 fats and iron for healing. And we added in that relaxation program that I told you about. So really, then, the goal of functional medicine is to help people find what they need to shift in their modifiable lifestyle factors to help their body heal. But then we also may want to track, right, and see how they're doing and how they're improving. And that comes here at the bottom, where you may want to do more testing in the future, depending on how somebody is healing or improving. You may want to do to recheck to make sure that dysbiosis, like I repeated her stool testing to make sure that dysbiosis improved, and it did. And I follow up on her iron and omega-3 levels. So we have other decision trees as well. We've got the IBS decision tree, and Dr. Hanaway is going to be taking you through this later on this morning or this afternoon, whatever time it is for you. Keep doing that. So this is a little bit different, but we're going to go through this again in a little bit to kind of go through, okay, how the dig-in model may be influencing if somebody has irritable bowel syndrome, and where you might want to be looking. Like, do they have digestive insufficiencies or dysbiosis or adverse food reactions or stress? What's causing their irritable bowel? We also have a gluten wheat related decision tree that also Dr. Hanaway is going to be delving into with you. And that can help you determine for this patient, where do they need to focus? So again, for Trina, she doesn't have celiac disease, and it's important for me to let her know you don't have celiac disease. But right now, you have some reactivity to wheat and gluten, and I think you're going to feel better. I think your joints are going to do better. I think your autoimmune disease is going to do better if you remove gluten. But we had that conversation in that kind of a way so she could understand where I was coming from and then make her best decision for her. So in clinical, the reason we show you this clinical case is really to show you the central role of the gut, right? How the gut impacts the overall body, how it can impact an autoimmune disease or inflammation. We wanted to talk about how genetics play a critical role and how environmental toxins can impact the overall health and well-being as well, and how all these things impact the immune system. We're really here to master clinical medicine, right? Which is mastering the story, the tools, and the therapy. And that is the same as when we're mastering functional medicine, right? As I said, it's really just mastering good medicine, really paying attention to the story, the tools, and the therapy so we can help our patients heal, right? That's what we want to focus on. What is their story? What do they need to do for healing? So it's really critical when we're working to heal our patients or heal with them, right? Or we're working for them to heal, right? Is we need to listen to their story. We want to really hear. We want to create that therapeutic partnership. We want to give them hope and let them know that we heard them when we retell their story so that they feel comfortable with where we're going. So it's really critical that we have gathered ourselves so we can hear where they're coming from and reflect that back to them. The art of healing is we discover through dialogue. We need that time to get to know our patient and understand where they're coming from. We want the history to be extensive and not just focused. We want to pay attention to the patterns that connect in our patient and in their story. We want to determine what is their readiness to change. We want to recreate meaning and connect, educate, inspire, and motivate. And appreciate how the body has this tremendous ability to heal, right? We want to activate that body's natural healing ability. It's the best tool we have. Don't forget some of these really important questions. These help me every single day when I'm working with patients. Every single day, okay? So what life event occurred just before or around the onset of your illness? So if you're stuck, go back and ask this question again. Maybe they forgot to tell you, or they didn't even remember the first time you gathered their information. When did you last feel well? I love the question of if you could erase 3 things with a magic wand, make sure that you are working to erase the things they want to erase. Sometimes we all have our different agendas, and it's important to recognize what theirs are. And ask them the question of, what do you think may be causing your illness? What contributed to your illness? We talked about the importance of, childhood illnesses, antibiotics, stresses, their environment. What's their environment like from a stress standpoint, from a mold, from a chemical standpoint? What is their digestive history like? Did they just start to have digestive issues, or have they had issues their whole life? Have they always been allergic to things, or did that just start? Those are important clues. Oh, and my favorite, that diet diary, because there's so much you're going to learn when you really look at what they're actually eating. People all the time say, I'm eating healthy, but really look to see what do you see when you look at the diet diary? Do you see signs of over restriction? Do you see signs of not restricting enough? Are they getting in some food additives that they didn't even realize were additives? Get that good dental history, and their nutrition-focused physical exam, their medications, of course, supplements, their habits, their stress, all really important, where we bring it all together and help to identify where their clues are for this patient and what's out of balance. Right? It's a web, it's a connection. It's a glorious feeling to perceive the unity of a complex of phenomena which appear to be completely separate entities to direct sensory observations, and recognize that it's all connected, right? I love how all these different lines are connecting all the different systems in the body. Unfortunately, in diagnostic medicine, we are focused on the disease, and that often ends our inquiry. But instead, it should be the beginning. That disease should be the beginning of asking a new set of questions based on our systems theory. Once we have the diagnosis, we ask that question, why? The diagnosis is not the end, but the beginning of our practice. We explore what may be out of balance. And what functional medicine has done is given us the tools to be able to do that, right? And remember, the GI system is integral to the overall health of the body. It is the essential node that impacts of illness in the body. And dysregulation in the digestive system has a profound impact of the overall health, not just the health of the digestive system, but the health of the overall body. And remember, we're going to come back to this dig-in model time and time again. So as Hippocrates said, all diseases begin in the gut. And we're going to focus on that this weekend. So thank you.